Hello and good morning, everyone. Welcome to the Alameda County Black Health Agenda event. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and we're really excited about our lineup today and the topics and everyone who's signed up to participate. And so I'll spend a few minutes just talking about what are we going to be doing while we're here and why we're here. And then I'll turn it over to Brittany Butler, who is our Senior Program and Research Manager, to talk a little bit more about the specifics around the Black Health Agenda and more detail about what we're doing today. So next slide, please. So just a few housekeeping rules before we get the ball rolling. So everyone will remain muted during the sessions. And so if you have any questions, make sure you put them in the Q&A box. You can say hello and give a shout out to anyone you recognize that's here today in the chat box, and make any comments or thoughts that you have about what the speaker's saying, what you want to share with anybody about your thoughts around that. But if you have specific questions, please make sure that you place those in the Q&A box so that we can keep up with all of them. Next slide. And I want to give a special thanks to the Alameda County Public Health Department for being our event sponsor today. So thank you, Dafina, for making that happen and making that possible. And you'll get to meet and hear from Dafina a little bit later this morning. Next slide, please. And then a little bit about what's in store. So there's two parts today. So part one is where we talk about the state of Black health in Alameda County. So we'll focus more specifically on what is happening in the community in Alameda County relative to mental health, COVID, breast cancer, as well as prostate cancer. We're going to talk about social determinants of health and specifically around tobacco, especially in light of yesterday in the election, maternal health, and then also a little bit more about social determinants of health. And we have Dr. Noha, who's going to be more specific and talk about how that relates to the health and well-being of the community, and specifically to Oakland and some of the housing and other determinants that impact the overall health and well-being of the Black community. Next slide. And then part two is where we start to deconstruct the health inequities and why some of these things are happening to our community in Alameda County. And so we'll have breakout sessions where we'll do a little bit of a deeper dive around these issues. We've got slated for this afternoon, social determinants of health, Black maternal health, mental health, COVID, and cancer. So each one of these sessions will be facilitated by a local person who's well-versed in each of these topics. So you'll have an opportunity to have more of an engaging, interactive discussion, share your thoughts and experience about what you know around what's happening relative to each of these different topics in Alameda County. And next slide. So just a little bit about the California Black Health Network, in case there are some on the call today who have never heard of us, even though we've been around for almost 40 years, but we're working on changing all of that. But we are the only statewide Black-led organization that really works to advance health equity for all Black Californians. And our vision is to create a California where every African-American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequity. So striving towards utopia there. And our mission in terms of how we go about doing this work every day is to ensure that all Black Californians, regardless of where they live, how well educated they are, how much money they make, who they love, how they self-identify, what their housing situation is, really has access to high quality, equitable primary and behavioral health care, and don't succumb to any disease unnecessarily. Next slide, please. And so a little bit about our campaign for Black health equity, which is our major initiative as a nonprofit to help continue some of the work that we do and invest in key specific areas. And so overall, our goals are to drive key policy changes through our policy initiatives that are really going to be focused on getting to the root causes of inequity and focusing on how we can address those at the system level of care. Also to enhance our program and educational offerings that are focused on healthcare professionals as well as individuals and patients to really improve and enhance the health literacy on both sides of that relationship. And then last, as I talked about before, we've been around for 40 years, but we're a little known the further you get away from Sacramento. So we really want to increase our brand visibility to become that respected thought leader amongst the healthcare community in general, and become that real trusted resource for the Black community. Next slide. And so you can go to the next one. And so there's 6 core components of the Campaign for Black Health Equity. That's the Black Health Agenda, the event that you're participating in today. So at the end of this process, we'll have a statewide strategy and plan that aims to close the gap in health disparities and ultimately improve life expectancy of Black Californians. We have the Black Health Network, which some of you may be members of. It's our virtual community where people can come together to connect, collaborate, communicate, and do some virtual networking. And everyone, the main thing they have in common is that we all work to advance Black health equity as part of the work that we do every day. And then the Health Equity Forum, some of you may have participated in some, which is really a showcase for subject matter experts in public health and health equity and public health. And so we've had members of the Herrera-Davis family participate. We've had Dr. Kizzmekia Corbett participate so that the community could really get answers about their questions related to the COVID vaccine. We launched the Health for Life initiative last year, which is our major initiative to improve health literacy. We engage in advocacy and policy initiatives, again, that aim to improve greater access, but also addressing the root causes of inequities at the system level. And then we are Cover California navigators. So we are certified to enroll individuals into healthcare coverage. So this is open enrollment season. If you know of anyone who is uninsured, needs access to healthcare, has any questions about how to get access, please have them reach out to our office. Next slide, please. So with that, I'll turn it over to Brittany Butler, our Research and Programs Manager at the California Black Health Network. Thank you all again for being here today.
Good morning, everyone. I hope everyone can hear and see me okay. I am Brittany Butler, Senior Research and Programs Manager as of this week. So thank you, Rhonda, for the kind introduction. And I'm just going to talk more about the Black Health Agenda, what it is, what our process looks like, and what we are going into the new year with the Black Health Agenda process. So the Black Health Agenda is a comprehensive statewide and county plan to close the gap in health disparities for Black Californians. It was actually, there was one conducted in 2019. It was done a little bit differently. CBHN went to multiple cities and did breakout discussions, distilling those breakout discussions and the community's needs into 4 focus areas, that is economic development, health policy, dental health, and mental health. And while that was a great start to the Black Health Agenda work, obviously 2020 brought a whole new wealth of challenges and disparities, and highlighted inequities in our healthcare system and beyond in our country. So we wanted to go with the Black Health Agenda with a different process, really addressing what does the data and thank you everyone in the chat. What does the data show, and what do folks like you know about Alameda County that is causing these inequities? So we utilize primary and secondary research and data from the input from a diverse group of stakeholders, you all, and through informational interviews. And we coordinate coalitions to increase accountability and connect thought partners with differing backgrounds and within each focus area. And to me, that is the most important role of the Black Health Agenda, is for us to have a center to have these discussions, to know who's doing what in the community and what great work needs to be supported and what resources are available to us. So for those who have been following the Black Health Agenda for the past 2 counties, in Sacramento and in San Joaquin County, you know there was a 4-step process, but now it's a 3-step process. We determined the baseline health measures, like I said, and then this stakeholder meeting and breakout discussions are really the point to understand why these issues exist. So we're going to talk about mental health, maternal health, COVID-19, social determinants of health in many different areas within that. And I think I mentioned mental health already. And cancer, which is usually a very difficult conversation to have. So we have two great cancer speakers today. And then out of this, we will create the Black Health Agenda report that will be germane to Alameda County and really give solutions to the discussions we had today and discussions I will personally be having in between now and the final Black Health Agenda report. Like I said, we started off in San Joaquin County and Sacramento. We are moving south and now going to Alameda. Next is Solano. We're gonna go to Fresno, San Bernardino, Riverside, King County, San Diego, and Los Angeles. These counties were determined based on Black population above the state average and the Healthy Places Index, which I'll talk about for Alameda County shortly. And just a quick note in the chat, or you can email me, which I'll put in the chat soon. If you would like to be involved or a stakeholder for any of these counties, please let me know and I'll put you on the stakeholder list and you'll get all the updates you need. So a little bit about Alameda County. The Black population is about 11%, which is almost double the state average, maybe just about. The Healthy Places Index is actually 92.9, which means that Alameda is ranked one of the healthiest counties in California. But it was included because of one of the cities in Alameda with a high Black population and huge health and wealth disparity region, Oakland, California, which I'm currently in. So shout out to everyone that I invited today. Thank you for coming. The air quality index is about 39, which is actually considered pretty healthy for Alameda County, but the discussion of California fires and Northern California specifically does affect the air quality and health of Black Californians. So I'm not going to go through every single metric here, but this is just an example and goes to show about how the Black population, there are greater disparities. And as we all know, I don't have to beat this drum multiple times, that there are greater disparities. The research shows it. Over time, it has gotten worse in some areas and better in others. But today, while the data is important, today I really wanted to really dig deep into the issues in Alameda County that account for these data for the past X amount of years. Why have they gotten worse? Why are we only addressing it now? And what historical, political, and social structures are in place in Alameda historically and through your own personal experiences have contributed to some of these data points, including infant mortality being 2 times greater for Black infants, the preterm birth nearly 2 times the white counterparts in Alameda County, and about 2 to 3 in all of the state, which is, California, one of the most resource available and liberal states in the whole US. Why the suicide rate for Black youth and for Black men and women have been steadily increasing over time, not over any other race, but has been increasing exponentially. Why COVID-19 messaging and information has been spread differently in a different way for the Black community that may have not been the most helpful or culturally relevant, and why cancer is one of the breast cancer and prostate cancer are the leading causes of death in cancer for Black people. So we're going to go all those kind of questions today. But before we do that, I do want to introduce our MC for the day, Nikki Thomas, who's a radio host. And Nikki, if you turn on your camera. Nikki Thomas is a radio host, digital creator, and certified yoga instructor, speaker, and MC. She uses her unique combination of skills and talents to motivate and empower women. She's an Aquarius, an 80s kid, and can be easily spotted because of that healthy, moisturized, gorgeous hair. So thank you, Nikki, so much for taking the time, dedicating the time to be our MC. I'm going to pass it over to you, and I'll be in the chat, everyone. I'll put my email in if you have any questions, but you'll see me at the end. Thank you.
Oh, wow. Thank you so much, Brittany. Can everybody see me and hear me okay? Oh, different today.
Yes.
Please forgive me because, you know, the hair goes through changes, but we are here today to do some incredible work. And I am so honored and blessed to be a part of today's event, Black Health Agenda. I love that, you know, those three words have come together, and it means so much. Also, thank you to everyone who has ever listened or supported KBLX and allowing us to come into your homes and your cars every day. Believe it or not, it's been 20 years on the radio at KBLX, and I feel very honored to just be a part of the Bay Area community. So today we're here to put our health first, to put our communities first, and to provide some answers and inspiration for some of the questions and issues that are on our spirits in our community. So let's get it started and just take a deep breath together. You know, sometimes we're all over the place when we want to get focused on one thing and this current moment. I read somewhere that it takes time to get into the current moment, which is strange, but it's absolutely true that we have to put our minds on the now and how grateful we are on this current moment, and for us to all be together. So let's go ahead and drop the shoulders down and take a deep breath. Let's just continue breathing, understanding that the answers to so many questions are here today, and that we're always in the right place, in the right time to do the work, and that we're so fortunate right now. That is the truth. We are so fortunate right now, because sometimes we can assume that the reality is something else, but we are in the luxury and the fortune of this particular moment. Again, another special thank you to the Alameda County Public Health Department for their support and sponsorship of this event. So we're just going to go ahead and jump right in. Our first session is mental health, and we have gotten all too familiar with the words mental health, what it really means, and how important it is. And it's kind of changed the way we think about self-care, because I think, you know, maybe a few years ago or decades ago, when we said self-care, we were thinking about Calgon, take me away. But nowadays, when we say self-care, we know that mental health is always at the top of the list. Yes, today, Jodie Geddes is a healer and warrior. She creates spaces for imagination and deep conversation around issues of race and equity. As a Jamaican native and Brooklyn, New York transplant, Jodie draws from her experiences to challenge others and herself to lean into difficult conversations. That's a skill and a talent right there, Jodie, but we'll talk about that in a second. In 2016, Jodie graduated from Eastern Mennonite University with a master's in conflict transfer manager of coming to the table, CTT, and acknowledging the racial wounds of enslavement. In 2019, Jodie Geddes and Tom DeWolf co-authored the Little Book of Racial Healing, hallelujah, coming to the table for truth-telling, liberation, and transformation. Denzel Herrera-Davis is a storyteller, life coach, and consultant living in Oakland, California. He is the founder of Create the Space, a novel approach to an organization that leads heart first to achieve its mission of bringing mental health and wellness to the forefront of awareness and access for people of color. Through Create the Space, Denzel has built a developmental wellness program for men of color that promotes healing, embraces healthy relationships, and challenges traditional notions of masculinity for men of color through a shared vulnerability in community workshops and events. Ultimately, Denzel hopes to share and spread his vision of community healing towards shared vulnerability and increase access to mental health care coverage. He is looking for men who want to take part in being the solution to their own mental well-being. I'm going to say hallelujah and amen a bunch of times today. For organizations that believe in and support the safety and developmental growth of their employees, and for healthcare and insurance organizations that want to help change the landscape of mental health and its coverage. Ooh, so much accomplishment. Welcome, Jodie. Welcome, Denzel. How are you guys feeling today?
I'm doing well. I'm happy to be here with Denzel.
Oh, wait, they're
Love
muted
the
still.
space
Okay.
and the work you all are doing. So super excited to be in community with you and others.
Absolutely. And can I
This
just
is
give a quick shout
wonderful.
out to Jamaica real quick? You out here. Hey.
Love it. Love it. Oh, okay. So I have like 100 questions in my head for us to jump into, but I'm going to start with Denzel. Because when we talk about Black men, mental health, and the words vulnerability, you know what I mean? It's like, it feels like it's a new space that we had to crack open. Can you talk about that little extra layer and how it, and how difficult it may be for men to just even the word vulnerability? It's just like, let's start right there.
Yeah. Well, thank you for the question, and thank you for the brilliant introduction also. And shout outs to everybody here, first of all. Thanks to you all.
Mm-hmm.
So that's what's up. In terms of vulnerability, right, when you talk about knowing yourself, and the idea that you go through life really trying to know yourself through the lens and perspective and expectations of other people. And as a man, there's a lot of paradigms out there and a lot of archetypes out there by which we should subscribe. But the one that's often left out is the self, right? The true vulnerable self. And because we're not practiced in that vulnerability, exercising just that muscle like every other muscle, then we don't know how to identify with self. And the things that happen when you don't know how to identify with self are pervasive and they're insidious, right? You lead people on because you tell them things that aren't even necessarily true about yourself. You don't know how to express your feelings and emotions. You don't know how to even use the language to connect what you're feeling to what you're trying to say. And so because of that, you end up spinning in a world where you don't have the outlets, you don't have the resources, you don't have command of your feelings, and the only thing that is happening is internal turmoil. And so to say all of that is why, as an organization, we focus
so
for Black men.
Love it. Love it. So what's mental health? How are they being addressed?
Specifically Black men?
Community period. Just when you say mental health, there's a whole lot of stuff attached to the words mental health. What kind of things are our community members facing?
Oh.
Can you guys hear me?
Yes, we can hear you. Jodie, do you want to jump in? I don't want to to hog the mic here.
Yeah, no worries. You can hog the mic. That's also okay. Yeah, I think that there's this kind of standard psychological medical definition of mental health. And for me, one of my approaches is really the well-being of people, right? And I think similar to what you just named, Denzel, the ability for people to show up in their fullness and recognize that, you know, the way that we engage with mental health is not about perfection. And I feel like often I've been in a space around perfection that it is challenging, even as a Black woman, to show up with sometimes the mess of like, I actually don't have it figured out, although there's an expectation that I might need to. And so for me, mental health is really about how do I create space for the well-being of anyone who really enters into space for them to show up as their full selves in moments that are challenging, but also moments that they're experiencing joy, and what it means to create that balance. And I think that goes into normalizing the conversation around mental health, that, you know, it is a wide range of things and it doesn't stay stagnant. And I think sometimes the approach that is often bounded by systems of racism and white supremacy don't give that grace to recognize that, you know, it is a spectrum and it is expansive, the way that we can hold conversations around mental health and wellness. I always like to include that language of wellness. And so my approach to it is really to explore with folks, how do they want to show up in the world? And what does that look like from a place of emotional wellness, psychological wellness? And I think that approach actually allows for deeper conversation around trauma, where someone doesn't feel like I'm trying to diagnose them. Although I don't even have those skills, but I understand the way that that language is interpreted, right? Because of the stigma, or many different types of stigmas. So for me, mental health is really about how do I create space for folks to show up in all of their stuff and explore what well-being looks like for them, and maybe not even what I want for them, but what they want even more for themselves. This is also challenging when you love people and you're like, I love you so much, I see this, but they're like, that ain't even what I want to do, that's not who I want to be. And now holding space for me to say, okay, how do I support you on the journey, or the many journeys that you're embarking on? So that for me is how I would describe it.
I'm so glad that I let you answer that question. Oh my God, that was great. The only thing that I will support that with is the idea of community, and how in isolation anything can be normalized, right? And so when it comes to our mental health, part of that is having proximity to others to see what is normal, or to see what is abnormal, right? And in so much of our community is in disparity and in this segregation or isolation, that when we experience some of these things that we question ourselves as abnormal, we have no reflection by which to say, okay, validation, yes, I have support to recognize that this is not normal and I should go seek something else, right? And without that, it becomes a detriment to us as well.
Wow. So in our current time, the word isolation is another big one, because of, you know, the various levels of isolation that we experience over the last couple of years. You know, I'm sure there's like particular anxiety that a lot of folks are dealing with, are coming out of. I kind of called it thawing out. You know, after COVID-19, it's like trying to come back to normal. Can we talk about like some of the things that you've been seeing in the community, or maybe hearing feedback from folks as far as coming back to normal, and the anxiety that, you know, kind of is looming over us trying to get back into normal space?
I'm being a little shady. I feel like people are not having those conversations as much as we should. It was kind of like, COVID happened, COVID's over. It really ain't. We can talk a little bit about what that means and what that looks like for different communities, right? Because there are different ways that different communities have been impacted. And I feel like, at least in my spaces, I've been really pushing to have that conversation to say, what does it mean to return? And also talk about what normal is and what normal looked like before. One of the beautiful things that I've seen is I've seen a lot of people take more risk and chances and an opportunity to assess, once again, how do I want to be in the world, and maybe recognizing they were just doing the same thing over and over again and not receiving joy from it, or not even an ounce of fulfillment, just keeping it real, right? And so that's been really beautiful to examine. And then on the other hand, I feel like there hasn't been a lot of space created for, I know many of us, especially on this call, as I'm seeing the names, have done that well. And I think there are some other spaces that haven't done that. Even thinking about when our young people are entering back into school, how to create the space to talk about what it meant to not be in a place that you might not even see as community, but now is being defined as community. And what does it mean to grapple with that? Or even for an organization staff that we serve, we're in service with others, but we've also been impacted. I know that organizationally, we're always doing a check-in because we're a restorative justice organization, and doing an opening and also creating space to talk about the impact on the pandemic on us. Like, I know I'm a new parent, I have a 3-year-old. It's a little, there's just so much that went into that journey. And, yeah, and holding space for myself, right? And working through that. And I've also seen that when we went online during the pandemic, there was a way that before I even did a check-in, just a bunch of people coming together, they don't even know each other. Some of our circles, like our Black women's circle, started online, like our first circle starting online, right? And thinking about how people were so ready to get there, not knowing me, that they were already sharing deeply with each other. And that was beautiful to witness, because even in spaces where people are physically in space, you don't always get that. And now we're virtual, where it feels like there's another barrier and people are just bringing it in. I'm like, let me do some agreements first. Let's do a check-in. And so I feel like I've been able to see a balance of all of these things. And what does it mean to create space to just talk about it, right? Not to debate data and statistics and theories, but to just talk about the impact on one's body in the yearning to connect, but also being told to be separated, or in not wanting to go back in physical space, which was a challenge for me. I was like, I can work out, I can eat now. Like, it's a little bit more flexibility to talk about all of those things without feeling the need to correct one's truth to guide them on some path. But like word vomit, just spit it out. And I feel like, you know, because we're a little bit maybe removed in terms of timeline, removed from the kind of onset of the pandemic, I feel like those conversations are disappearing, and have to kind of remind ourselves, like, I know I wear a mask. And then it's when people are like, oh, why are you wearing a mask, that we enter into that conversation. But what does it mean to still keep this conversation going? Because in many of our communities, we see the lasting impact of COVID-19 and all of the other things that followed. So I'm gonna pause there and pass it to Denzel.
Yo, kudos. I have nothing. That was amazing. I support and agree with everything.
Yeah. It's so many different stories that have come out of this. What are the most prevalent mental health disparities in Alameda County?
Man, you can pick one. I'm gonna say access. There's an asymmetry of information. There's an asymmetry of access points, and it's really targeted in my opinion, perhaps systemic, and because of that, you find that in Alameda County, and specifically, like, one of the reasons that I'm actually, enjoying being here is because of so much opportunity. There's so much resource. There's so much progressivism, so to speak, that those with the ability and the know-how have a great playing field within which to operate. But then you look around and you can palpably see the disparity, right? You have to step over it in the morning, depending on what neighborhood you're in. It might be on your doorstep. And And so I think, you know, to share a story, I'm a trained peer specialist and with lived experience. And I woke up one morning to an altercation outside on my street, and a neighbor was getting into it with a young lady who obviously had mental issues, she was dealing with some mental challenges. And I was able to step in and intervene. And after about 30 minutes of trying to calm this lady down and get some sensible conversation out of her, she started rattling off all the things I could do to help her. And I started naming some of the resources that were available. And she hit me, she was like, yes, I've been there, I've done all of that. And she gave me a pamphlet, and it was about 30 pages thick. And she was like, if you really want to help me, you can fill this out. And it was the information that she had received from one of the services, the housing services, that she needed to fill out in order to even actually receive service. And I went through the information, and I was floored, because in that moment, I felt helpless to help this person, because the resources that I was trying to provide for her were nothing but roadblocks for her. And I think this is an example of how much resources we actually have that aren't actually getting to the people who need them, because of systemic and what otherwise can be deemed as racist practices.
Wow.
I'll say friend speaks my mind, which is a part of like Quaker tradition. Like, I agree.
So that is
yeah, I'll say friend speaks my mind. And I'll also add to that to say, it is, I think sometimes people might see this as an excuse, but it's challenging to think about your mental health when you've been kind of getting along just to get along, right? And you've already kind of established that routine of, I can do this, I got this, I don't need any kind of support or scaffolding, in addition to the challenges around housing, right? Like I don't know, I feel like, and to be clear that I didn't grow up here, right? So it still constantly feels like a shock when I examine the wave of homelessness and the close proximity that even some of us on this call have to it. And so when I find myself supporting someone, it isn't just around providing a warm handoff to another agency to support kind of mental wellness, but it's also around housing, it's also around education, it's also around support for their children or others that they're caregivers for. That is a lot to be able to carry. And many times I find folks kind of exploring, what do I need to prioritize, right? And in supporting with like a warm handoff, having to do multiple times. Sometimes there are people that I'm connecting with 9, 10 times, and that's okay. And for them to have the permission to say, I'm not there right now because I need to focus on this thing, or I'm not there right now because I need to focus on this thing, is something that's important. And being able to be in relationship with agencies who can do that, right? Like, you might have a timeline, which I totally understand. All right, 3 attempts and that's it. But some people need 9, some people need 10, right? Whether they know you or not. And so I just think about what it means to hold all of those things. And I come from a different lens because, of course, it is also a part of my work, not just my life, but also my work, and having to recognize that some people are not engaging with that on a daily basis. And so I might be like, let's just do it. And it might feel a little bit more, have a little bit more ease for me, but that looks different for others. And so for me, really trying to check myself, right, all the time in my proximity to support and services, to say, okay, if one needs to prioritize housing, how then do I support kind of life planning that also goes beyond their relationship with my agency or another agency? And so I also think that's important to be able to acknowledge that a lot of times people get blamed and shamed for not accessing the service. So someone was like, well, it's there. So people get blamed and shamed for not accessing it. But when I'm thinking about housing or, the community violence that I'm witnessing as a parent, or food insecurity, that feels like more of a priority rather than some of these other things. And how maybe can I have support to say all of this is possible, right? Or to create a plan, right, that is also easy and accessible and doesn't have to be grand. I think that those pieces are really important. And that's also, to name again, a learning for myself, right? When I look at people and I'm like, I see the fullness of who you are, but someone might have tunnel vision of because of where they are in the moment, to hold that moment space, and not just dreaming of who I want them to be, but who they want to be and how they want to engage and interact with the world, which is hard. I think it's important to acknowledge and name that when you want things to be fast and quick. But there are sometimes other challenges I feel like it needs to take priority.
So a lot of love in the chat for the story that Denzel just shared with us, and super powerful, and it says a whole lot. So I want to jump back in and ask either of you to speak on, when we say mental health, that absolutely involves having to step in for someone who may be suffering, who might have a mental health issue, and to advocate for themselves. Do you have any advice, maybe, or some words of wisdom for when we find ourselves in a situation such as that one, where it's like, what this person is having, an issue? How do I step in and try to help them solve, the basic needs and get these things taken care of for them?
Well, it depends what day you ask. Man. So the truth is, like, I recognize the duality, right? There's the rules and the regulations and the systems are in place to protect people, protect the service providers in one sense, to enable them to do their job the best, right? And so as a founder of an organization, as a practitioner, as a consultant, as the person who does everything, and a service provider and a peer specialist, I find myself like juggling between spaces and roles. Because I can walk out of my door and find myself intermediating between a situation. And then also that same day, bogged down in the office doing 3 hours of data collection and paperwork, because I don't get funding if I don't do my data and my collection. And so I can't just go out and help somebody and then also be like, yo, this is my free time, because I have to go back and then share what am I doing with all my time, and where my support resources going, and where my energy is going. And why I should be getting my funding. And so there's quite the duality there, if not a triality, in really preserving self, also helping others, and then adhering to what the actual requirements are. And so I think what I'm going to do is go out there and say that we need to really start thinking about how we streamline the process of getting the resources to the people that need them, and the organizations that are actually on the ground doing the work. And yes, there needs to be some back-end support, I would say, in addition to that, right, if we need this data and we need the access and we need the information, we can't hamstring the people doing the work by also asking them to be experts in all of the other things as well. We need to be able to support people in their zones of genius and provide those lanes for them to operate and to run, and then support them with the things that they're not great at.
Well, I love that there's zones of geniuses. Is that what you said? Am I making that up?
Right.
Yeah.
Right.
Yes. You heard
real
it.
quick, Joe. Love it. So real quick, Jodie, how can one join the Black Woman's Circle?
I will drop the link in the chat to be able to register. And then Demisha also just sent it to you, but I'll drop the link in the chat to register. Folks can also get connected through the Ardua website. We have over 10 restorative justice circles that are happening weekly over a wide range of communities, centering African-American healing and people of African descent, although it invites everyone to come to the space. So creating that balance. Middle school circle, this is not what you asked for, but I'm gonna give. We have a middle school circle, queer circle, Black women circle, Black male circle. So we have a bunch of circles, and we also partner with organizations like Youth Uprising, EOYBC, and a few others to be able to hold those spaces.
Mm. Wonderful. Okay, so we want to absolutely follow and support. Where can we get a hold of each of you to connect and learn more?
Definitely. So shout out to you, Jodie, because you are dope. I need to get in touch with you because we gonna have to do some work together. Yes, super dope. In terms of getting in contact with me, you can always check out our website. I will leave the information in the chat. It's createthespace.com, CR8 thespace.com. We also have a number of programs for men and community at large that you can get involved with. Similarly, we have men's circles, we have media circles, we have storytelling platforms, we have a curriculum that we teach, a number of workshops that we lead for Black males, community building. And so you can find all of this again on our website. Also, we're very active on Instagram. The IG is popping, create_the_space. And I would share all of this information. And we have a large media profile too. So there's a lot of videos and content out there that I'd like to share with you all.
Wonderful.
You can look me up on the
Wonderful.
Archway
Thank
website.
you both.
Go ahead. You can look me up on the Archway website or my own website that I'm learning to get better at promoting, which is jodiegeddes.com. All the information, you will find it there, as well as on Instagram and Facebook, and I guess we'll see about Twitter. But that's where you can find me, those two websites that I've also dropped in the chat.
Wonderful. Thank you for sharing. We will definitely follow and like and share and support. Thank you for just like dropping the seeds in there. Thank you for the work that you're doing. Denzel, Herrera-Davis, and Jodie Geddes, thank you so much for joining us today.